Welcome to the Mount Lebanon School District. This presentation will be a brief overview of the Nursing Services Department at Mount Lebanon. For some of you with older children, this will be a refresher course. For those of you who are new, welcome to the Mount Lebanon School District. We look forward to working with you to keep your children healthy and learning. Emergency contact information. In the event that your child is ill or injured, it is imperative that we find your list of emergency contacts that can pick your child up within 30 minutes or sooner if needed. Please remember to include parents and guardians as part of emergency contacts. When you come to pick up your child, you may be asked to provide identification before your child is released for safety considerations. In August, you will receive dashboard account information from your child's building secretary to input the emergency contact information. The next couple of slides will review the Pennsylvania Department of Health requirements. The most time-sensitive is the immunizations requirement. Your child may not enter school on the first day unless your child's school nurse has proof of all required immunizations by August 1st of this school year. If your child is not able to receive required vaccines prior to the start of the school year, your physician's office will need to provide documentation to the school nurse prior to the start of school. This documentation must include a signed note by a physician stating what immunizations will be administered and the specific anticipated date when your child will receive the required vaccines. Please refer to the links on our website for immunization requirements. The next would be the Pennsylvania Health requirements for physical and dental exams. These are included in your child's kindergarten registration packet. The state of Pennsylvania requires parents or guardians to submit proof of a physical exam, also known as a well checkup, and a dental exam upon entry into school. The exams must be dated after September 1st, 2022, and will be accepted throughout the 23-24 school year. Also included is a health history form. Please complete and submit the health history form prior to your child starting school. Knowing about allergies, medical or surgical history, and chronic conditions helps the school nurse provide proper care and a safe environment for your child. For health concerns, please reach out to your child's school nurse as soon as possible if your child has any chronic health condition, a severe allergy, asthma, seizure disorder, requires daily or emergency medication, or if your child has any diagnosis that may affect them during the school day. It is important that the nurses have time to work with the parents and guardians to develop an individualized plan of care for each student. Once this plan is developed, the information will be shared with teachers and staff who need to know. Medication policy. Both over-the-counter and prescription medication requires a doctor's order to be administered at school. The medication administration form must be completed and signed by a parent and physician. It also must be dated July 1st or after of 2023. Over-the-counter medication must be in original, unopened containers and match the physician's order in both dosage and route. Example, if a prescriber orders liquid Tylenol, then liquid Tylenol must be sent in. The prescription medication must be in a pharmacy-labeled container and match the physician's written order. A new order and bottle with current label is needed any time a medication is changed. If a medication is to be discontinued, a physician's order is needed. Self-carry and self-administration of medication. Students are only permitted to self-carry and self-administer certain emergency medications and must meet the following requirements. Prescriber ordered that student may self-carry and self-administer. Student meets with the school nurse. Parent or guardian must also sign off on a self-carry, self-administer medication order. Once they have that, this nurse will provide that they are able to administer the prescribed emergency medication independently and correctly. The following medications are permitted to be self-carried or self-administered: epinephrine auto-injectors, rescue inhalers, or diabetic supplies and insulin. Communicable diseases. The Mount Lebanon School District follows the Allegheny County Health Department's guidelines for communicable diseases and exclusion from school. Please notify the nurse's office if your child is ill and keep your child home until they are cleared by their medical provider and/or are 24 hours has passed since their symptoms or fever has resolved or they have started a course of antibiotics. Some reasons to keep your child home include nausea, vomiting, diarrhea, temperature of 100 degrees or above, diagnosed with strep throat, pink eye, or any other illness that may be contagious or that requires antibiotics, or an undiagnosed rash. Please watch for more information regarding COVID and illness guidelines that will be provided to the district parents in August. Please feel free to reach out to your child's school nurse to discuss your child's specific health needs. You will find your child's school nurse information on the district's main website. You can also feel free to contact Mrs. Deanna Hess, Chairman of Nursing Services, who oversees the Nursing Services Department. Thank you and welcome to the Mount Lebanon School District. We look forward to working with you to keep your children healthy and learning.